Hi, I'm Dr. Tom Danisiewicz with Airrosti, and today we're going to be discussing rotator cuff injuries. We'll talk about some of the causes of rotator cuff injuries, as well as some of the signs and symptoms that may indicate you have this condition. We'll discuss how the traditional medical model typically handles these injuries, and how at Airrosti we're just a little bit different. Let's get started. The rotator cuff is made up of 4 separate muscles that individually help rotate the arm, but when working together help stabilize the ball and socket of the shoulder. We can often create damage or trauma to this area by poor posture, muscle imbalances, overuse injuries such as throwing a ball or in racket sports, or trauma like falling on an outstretched shoulder. Some signs and symptoms that you may have a rotator cuff injury include pain in the shoulder. Often this is going to be in the front or the top of the shoulder, and it's going to be described as very dull and achy. Sometimes it's very hard to pinpoint where that pain is coming from. Generally, you're going to have pain with shoulder movements, especially overhead movements or reaching across your body, or maybe in the activities that contributed to the problem in the first place. Lastly, it's very common to have shoulder pain at night with rotator cuff injuries, especially as you're laying down to bed. So now let's talk about how the traditional medical model typically handles rotator cuff injuries. You're often going to be asked to rest from activities that aggravate the area as well as ice the area. You may be prescribed medications, either over-the-counter or prescription, to help reduce inflammation. And if you still have pain, it may be recommended you have an injection in the area. So now let's talk about how at Airrosti we're just a little bit different. Every patient receives an hour of one-on-one care with their provider, where they will receive a thorough evaluation to help come to a proper diagnosis and understand the root cause of their pain. They then will receive hands-on manual therapy to take care of any soft tissue component associated with their injury, and rehab exercises that include strengthening and stretching to help maintain the progress between their visits. We hope the information we presented to you today was helpful. If you or someone you know are suffering from a rotator cuff injury, please click here to schedule an appointment. We offer both in-clinic and telehealth options. And if you'd like to watch more of our videos, please click here, and don't forget to subscribe to our YouTube channel here. Thanks very much for watching. Have a great day.